Thanks very much. I'm now going to welcome Dr. Millie Neuman to the stage. Millie is from the Department of Public Health in the Trimbos Institute in the Netherlands, and we're delighted that Millie is here today. Millie works in smoking cessation, stop smoking services and addiction services in the Netherlands. She also set up the EU Quitlines project, in which European countries exchange best practice on quitlines, and thankfully Ireland is a member of that group as well. I see Elaine is our rep on that. So we have a lot to learn from our international colleagues in terms of treating tobacco dependence and addiction more generally. And Millie is going to talk to us a little bit about the language that we use in stop smoking services and how we might speak to people in a certain way in terms of engaging them in stop smoking. So thank you very much. Very welcome, Millie.
Thank you. I've been trying to practice this diarrhee. Okay, very good. So, thank you to the HSE for inviting me to address you all today on this World No Tobacco Day, 31st of May, 2022. How wonderful it is to meet people in 3D again, as you all. Thanks to Martina Blake and Edward Murphy and Craig Melvin for sorting out all the logistics, and a special thanks to Elaine Buckley, whom I was fortunate to meet some years ago online. Today we met live for the first time. It's an honor to speak here in Ireland as your world leader of tobacco control policies over the past decade. You have achieved an impressive reduction of smokers over most of the last years, and I understand your aim is to reach 5% in 2025 by denormalizing smoking through Empower and the tobacco Endgame, or parts of it. That would be amazing and an example to many of us. Today I would like to talk to you about something I come across in the Netherlands. First, I will tell you something about who I am and where I work, and then I will share my thoughts on smoking cessation and language, and I would like to hear yours. I work at the Trimbos Institute. Next. Yes. Trimbos is an independent, non-profit, project-based research institute in the Netherlands. We gather knowledge on well-being, public health, and addiction, and we are situated in Utrecht, only half an hour from Amsterdam, but we have our own canals. Trimbos has a number of core themes, including tobacco control research, the National Expertise Center for Tobacco Control, NET, and the Department of Public Information, where I work, and that informs people about cessation and cessation support through our Quitline website, Stopline, and Ik Stop Nu. Where I work, we are in touch with people who want to quit every day. The first-hand experience makes me think about how we can improve smoking cessation every day. So, at the Trimbos, I have a lot of colleagues working on smoking cessation, and this is done on a national and international level. My journey on this international level started back in 2020 when COVID hit and I had to rethink my life, probably like many of you here. In the rethinking, I was curious to get in touch with quitlines from other countries. How do other countries reach all smokers? So when my kids were finally allowed to go back to school after many months of homeschooling, I was sitting at the breakfast table and started to look for other quitlines. I started with Sweden and talked to more and more quitlines. Everyone I spoke to was enthusiastic, had new perspectives, and was interested in getting together. That is what made me decide to set up a network that Elaine joined as well, fortunately. Elaine, me, and 7 other colleagues get together 4 times a year, exchange information and best practices from our countries. And even when I'm low on energy, the EU Quitline meetings are always fascinating. We inspire each other. To give you a couple of examples, the first person I talked to was Caroline from Sweden. We had a great talk, and Caroline was actually one of the first to tell me that for young people in Sweden, the environment was a good reason to quit or never start. Did you know, for instance, about cigarette filters? Apart from giving a false sense of safety and making tobacco products less harsh and more palatable, they are the greatest source of floating microplastic. Well, I didn't know. And Nina from Denmark told us that the vaccination centers to provide people with information in smoking cessation, as I understand you do here at the influenza vaccinations. In Germany and Austria, they work with smoke-free tickets when somebody leaves the hospital. And Elaine and colleagues tell us about all the great things happening here in Ireland, like getting people to participate through social media by signing up for a quit plan, helping pregnant women to quit, and so much more. Do contact me or perhaps Elaine if you would like to know more about it. I love talking about the EU Quitlines, and being in touch with my European colleagues has taught me a lot about our common goals. We are all looking for a way to become smoke-free societies, and we also encounter the same difficulties, which we are trying to solve, often using similar language. In the Netherlands, 8 in 10 people would like to quit, and 9 in 10 people don't want their kids to smoke. We all know that intrinsic motivation is one of the key elements in quitting. And the language we use in smoking cessation can make all the difference in finding your motivation. So today I would like to talk to you about my findings on language in the Netherlands and the Department of Public Information. My daily work consists of providing people with information and advice on how to quit. I think I skipped oh, there I have it. On how to quit. And as I said before, we do this through our Quitline and chat and website. Throughout my career, I've found that language and how you put things is very important. I worked for years as a mediator, and as a mediator, I know that it is important how you frame things. If you're in a conflict, for instance, with your neighbors, and you can see the bigger picture, it is often a win-win situation. Positive perception creates a different perspective. And perhaps it's strange to talk about language here in Ireland because you're famous for storytelling and know all about the power of words. So I may be preaching to the converted. From what I can tell, you might already be ahead of us by talking about quit journeys and quit leaders. Nevertheless, I would love to know how you view some things that are very common in the Netherlands. I wrote a piece about language and smoking cessation on our website, and it resonated with quite a few people, including smoking cessation professionals and addiction clinics. A lot of people that ring us say that they want to make an attempt and to stop smoking. I would like to argue that it would be very good to do away with the word attempt and also focus on which words we use in a broader sense. The people that ring us tell us that they have tried everything, but nothing works. Usually we get a list of things they tried, both non-evidence-based approaches like laser therapy and acupuncture, and also evidence-based approaches like NRT. So they ring us and tell us they have tried everything. They made a quit attempt and they have not succeeded, often followed by that they had a slip-up, have failed and would like to try again. Of course, we then explain how smoking for most people is a full-blown nicotine addiction, and that tobacco is up in the top 3 with heroin and cocaine and how addictive it is. That you need to address both the physical and the mental side, that that's the only way to fight the addiction, that you can do so by making a plan, using NRT correctly and sufficiently, and that there are many health professionals that can support you. However, often the feeling of having failed sticks, or other people tell them they failed. I would like to argue that every time you stop smoking is valuable. So let's do away with words like attempt, failing, and slip up. It would be helpful for us in the Netherlands, and maybe other countries as well, to use new language when it comes to smoking cessation. New language like getting ahead, learning moments, and quitting process. What associations do you have with making an attempt? An attempt to finish something. An attempt to stick to your New Year's resolutions. My association is that something doesn't work. You try, but since your starting point is not to achieve your final goal, it remains in a vacuum. What association do you have with failing or slip up? Personally, I don't get any energy from it. This is why I do not particularly like these words, or as some might say, I wouldn't start from here if I were you. So, for instance, why do people use quit attempt anyway, I wondered. The answer came from a healthcare professional in the addiction field. He told me that this is the term used by GPs to gently nudge the idea in a patient who hasn't yet thought about quitting. But let's face it, everyone who is committed to a smoke-free generation wishes that everybody could get rid of that horrible addiction. Not that you cautiously hope it'll work out, but that you work really hard to get to more oxygen. And it's certainly not always easy. Actually, it's often quite hard. That's what people tell me every day. And yet, everybody who quits will tell you it's so worth it. So it's important that you don't try to stop, but stop. One day, 28 days, a year, and preferably a lifetime. That quitting is essential. Let me see about the slides. No, not there yet. That quitting is essential for a healthier life should be self-evident by now. In fact, we know from research that most people stop. That most people stop several times before they quit the addictive tobacco products for good. So, apart from the lucky ones, the process of quitting is often so much longer than the first time, or the 5th time, or the 10th. And all those times are part of the same stopping process. So why do so many people reduce quitting to one time and talk about relapsing when you encounter a setback? When COVID started, I, like so many of you, started looking for new ways of exercise. My form was to walk for half an hour around the canal we live next to, listening to podcasts mainly by Simon Sinek. You may know him from his TED Talk in Start With Why on how to build successful companies. In one of his podcasts, Simon Sinek talks about his book, The Infinite Game. He explains the difference between finite and infinite mindset. It is essential how you look at things. In the podcast, he explains that an infinite mindset is good for long-term strategy. It can change the way you look at life. To give you an example, last week, I was at a campsite with my eldest son. They had a ping pong table, and when we played to win, neither of us were very happy. I have 4 brothers, so that explains it. But when we played creatively, it went on and on. We would try to keep the ball on the table, and at some point, my son was even playing both sides by himself. So in the podcast, Simon Sinek interviews Dr. Kars, who gave him the idea for the book. And this is how Dr. Kars explains it. If you get into a game in which you make up things as you go along, you can play something all day long. It creates a different climate, a different way you relate to each other. It generates creativity. And in a finite game, you have already figured out what to do. Your big decisions are already behind you, not ahead of you. And all your moves are thought out in advance. In an infinite game, you wait to see what the thoughts are as you move into the situation. You're always operating with a certain degree of novelty that you will not necessarily use in a finite game. Recap. In a finite game, all your best thinking is behind you. Now, it's simply the muscle memory of the application, whereas in an infinite game, all the best thinking is yet to come. You have no choice but to step into the unknown. And that is unnerving for quite a lot of people. The finite game is much more tangible. The infinite game is not the absence of finite games. It's the context in which finite games may exist. You can have wins and losses, and in pursuit of something greater. The finite game is about winning and losing. The infinite game is about being ahead and behind. By keeping your goal in mind and not being blinded by what doesn't work, you become stronger and more inventive. Dr. Kart also talks about the military. The military trains you to minimize the element of surprise. That is why there's so much training. An infinite player trains himself to be surprised instead of to keep it from happening. The situation is bound to develop in a way that you cannot anticipate. And to get back to quitting, the same goes for quitting. You may encounter something and you need to figure out how to deal with it. A lot of people start their quit journey full of optimism, knowing that they want to quit. Often they think about winning and losing, and if they don't smoke, they often stay optimistic. However, if they're unprepared for the element of surprise and do smoke, they often feel that they slip up and fail, even though they've made so much progress. And it happens a lot. People who lose a loved one, who go through a divorce, who have to deal with some kind of stress, or all of a sudden have too much time on their hands. At the Dutch Quit Line, we often explain this. Many people call in and say they've tried everything. Was it? Oh. We've tried everything, but they haven't succeeded in stopping or quitting. When you ask them about it, it turns out that they haven't smoked for a few months or even a few years. But because that successful period was cut short by a situation for which they weren't prepared, they consider their attempt to have failed. Often we find out together that people are apparently very good at quitting, but that they're still in the learning process. That they actually already have quite a few successes to their name, and when you say that to a caller, you can often hear the smile on the other end of the line. People feel ashamed after they encounter an obstacle. They feel like a failure. They don't dare to go back to the quit coach or health worker, even though they've had good experience with them and were well supported. And they certainly don't dare tell their friends. Some of the friends might say, "You see, you can't do it." And when I have someone on the phone who has such friends, I tell them they can call us too. Then we'll explain in detail that smoking is a physical and mental addiction for many people, and that the tobacco industry does everything to maintain this addiction. So, can't we make a bingo card for people who would like to quit smoking? Smoke-free bingo. When my children were smaller and had to learn how to read, they used to get a reading bingo for the holidays. I don't know if you have it here in Ireland as well. No. So read on the sofa once, read in your favorite spot, once upside down, once on the toilet. So they try everything to get them to read. And a bingo card for quitters would have, for example, the following boxes. Once smoke-free at a party, once smoke-free when you get bad news, once smoke-free when you're stressed, and one smoke-free when you are having a moment for yourself. And that when you have ticked all the boxes, you will be put in the limelight, because every time you stop smoking is valuable and should be celebrated. Okay, thank you. So,
thank you, Millie. Thanks so much, Millie. We have a lot of new Stop Smoking advisors in the audience today, and I think some of that is really thought-provoking and interesting, and I'm sure they'll be stealing some of those ideas, especially that bingo.